Staying on the sports theme, we've now got Professor Patria Hume. She's a professor of human performance whose research focuses on sports performance biomechanics, and she'll be talking to us about the long-term brain health for sports athletes. Thanks, Patria, and thanks for jumping in at the last minute.
I'll just wait for the slides to go up if you... Fabulous. Right, well, it's just as well I used to be an elite athlete and I'm used to just, stepping up and performing. Right. Okay, so what we're going to talk about today is long-term brain health for sports participants. What I want you to imagine is that you can get a brain warrant of fitness, just like you get for your car. Wouldn't that be fabulous? Just like a car where we check for rust and the integral structure, we can look at the structure of the brain. As Mango has indicated, 3 different options. Here, if I can get this to work properly, we can see a scan of Gordy, who started contact sports from the age of 4 years old, and in his brain there are structural changes where the sulci, or the grooves in the brain, are deeper and there's more spaces. In the car, we look for the spark plugs to make sure that they can spark and fire and our car keeps going. Well, it's the same with the brain in terms of the axons and the ability for the structure of the brain to function. And again, Mango has indicated how we might image the brain. In a car, we have a motor and we need quality oil for our motors to keep going. In our bodies and the brain, we have blood circulating and we need to ensure that all is working well. Well, we now have technologies through blood tests to be able to look at components of the brain that indicate acute concussions, and they will soon be available as point of care in medical facilities. With these acute blood tests, they do have timelines. So GFAP, for example, has a peak and then declines over time. We don't know what happens with long-term repetitive head injuries and how these blood markers might change. We do know that there are differences between males and females, and the hormonal cycles do affect salivary markers, microRNAs, different blood markers, just like we have differences in risk ratios for musculoskeletal injuries like hamstrings, and males having 1.57 times more likelihood of having a hamstring injury than a female. Females have an increased risk of bone stress fractures. We know from initial evidence that females have an increased risk ratio of showing longer recovery from TBIs and increased symptoms. Keeping with the car analogy, we need to pass a driver's license. We need to be able to make informed decisions, use what's called executive functioning, to be able to decide to stop at that light or to miss that pedestrian. It's the same in sport. We need to be able to make informed decisions how to tackle, to get our head out of the way of a knee or a hip in terms of rugby, for example. And with the King-Devick test, we are able to look at our eye tracking ability to see what effects we have with acute concussion. We've shown in a recent study that non-medically trained people on the sideline can use the King-Devick, and associated with a process that we've developed with the Mayo Clinic in the USA, to identify people that potentially have concussion and ask for them to be referred to a general practitioner to get assessed. Now, it's really important with these types of tests that you have baseline measures or controls, because we've got a lot of individual variation. And these types of tests are only one of multiple number of tests that we might need to accurately identify what our brain health is like. There's another device called the Brain Gauge, and with our collaborators at Axis Sports Med, we showed that with 79 patients, you could track their recovery over time. With this brain gauge device, it's like a mouse that you use with your computer, and it provides tactile stimulation, and there's a variety of different questions where you have to determine if it was your right finger or your left finger and if they were the same, etc. What these types of devices show is different areas of the brain recovering at different times. So if we look here, we can see different types of tests, and across days we can see how they change. Because we know that our symptoms that we report, like headaches or dizziness, they recover a lot faster than our neurophysiological functioning. So it's really important to be able to measure a variety of different assessments. So why does this matter? Well, as has been indicated before, sports TBI is a large proportion of the total TBIs in New Zealand. So there's about 35,000 head injuries in New Zealand each year if you take the ACC data. And sport is between 20 and 30%, and unfortunately rugby union that is, accounts for approximately 1/3 of those. There's been a lot of media attention because there's been rugby players who have had diagnosed CTE upon their death, and Helen will be talking more about CTE. And there's a lot of questions about how do we know whether I'm at risk of neurodegenerative disease, getting Alzheimer's or dementia, and do I have CTE? And there is a lot of anxiety in people, and they want to know. So if we were able to provide them with quality, quick feedback to say, hey, I think you're okay. Okay, you might need to go and see Josh to have that anchor drop and figure out the anxiety level. Or there might be something going on here and we need you to go and see Mangor and to get a scan. Or, A, B, C, D. So it's providing quality data because knowledge is power, and it's about making an informed decision as to what you can do. I used to be a lower limb injury biomechanist, and I got dragged into being some kind of brain health expert internationally by Dr. Ken Quarry, who's over here, who used to be one of my PhD students. He's now the senior scientist for New Zealand Rugby. And even in the media, Ken and I have had lots of quality debates about what is the effect of repeated brain injuries or concussions, and what might be the potential long-term health outcomes for rugby players. So World Rugby and New Zealand Rugby have been very proactive in terms of funding studies. So this 2012 study, where we looked at 485 participants in 3 different groups, an elite retired rugby group, an elite community rugby group, an elite non-contact sport group, which ended up having quite a lot of contact because they were cricket players who got hit on the side of the head. Anyway, when we had done these 4 studies, looking at their general health via questionnaire, looking at their brain function via the CNS vital signs computerised testing, when we'd looked at their balance, and you can see Buck Shelford here in the lab with Denise being assessed for his dynamic balance, and also other more specific brain function tests with brain excitability, we did identify that on the whole, the athletes, retired athletes, were pretty healthy, but those with more reported diagnosed concussions did have some deficits in terms of executive functioning of their brain, for example. So this led to us then expanding the study to the United Kingdom, and we looked at the mental health and well-being of retired UK rugby players, and we showed that indeed those who had, for example, more than 5 concussions had increased anxiety, increased sleep disturbance, and there was further calling for the need to be able to look at retired players and what the effects of their participation were. Now, it's not just rugby, even though, internationally there's UK lawsuits, there's US lawsuits for football. It's surfing, it's equestrian, it's cycling, it is football, Boxing, we've actually done studies in boxing with mouth guards. They're a fantastic group to look at because, it's the only sport in the world where the aim is to knock someone out. You win by making someone unconscious. I seriously don't know why we still have this sport, but that is the aim, and they go in knowing that that is what they want to do. So it's a very good group to be able to study for traumatic brain injury. We're getting quite good at now educating people about what an acute injury is, how to identify it, how to get assessed. What we're not very good at is understanding what's called subconcussive blows. This is where you don't have a concussion diagnosed medically. There's no particular symptoms that are reported, but there's the concern that you have repeated head impacts and it's somehow damaging the brain and it is accumulative. And this is where some of the international litigation is about. It's like, you didn't protect me because I had these repeated head knocks and I didn't know that it was going to affect my brain. Well, we don't know whether it is or how it is affecting our brain. We can measure the impact biomechanics, and for over 15 years we've been doing this with instrumented mouth guards and with ear patches. This slide shows an example of under 9-year-olds where we used the ear patches, and we showed that there were 15 head impacts per game per player. What it does show is that even though you may only have one impact here in this group over 95 Gs, there were a lot of impacts, 121, that were over a certain threshold for rotational acceleration. It's the rotation of the brain which is likely to cause more damage than just straight linear movement of the brain. Now, that study was over 10 years ago. Just last year, we also reported some data for adult females using mouth guards, and again, it shows that the impacts have not really decreased. This was 13 head impacts per game per player. So we're still having a lot of impacts, even though we've provided education, we've changed technique in terms of tackles. I want to now introduce you to the concept of the digital athlete. This is Dr. Doug King, and he's on the field dealing with an anterior cruciate ligament injury. We know from our laboratory studies, I'm a biomechanist, so I do a lot of this data where we put markers on people and we collect them doing movement patterns in the laboratory. And what we can find is that from a ground reaction force underneath our foot, using inverse dynamics, we can calculate the stresses on the anterior cruciate ligaments to see whether they're going to be at risk of rupturing. What you want to be able to do is take it from the lab to the field. So we want to be able to assess in real time, can we predict whether someone is going to have an anterior cruciate ligament injury? Well, yes, we can. So Professor Jackie Alderson at University of Western Australia collected data. They have over 500,000 trials of people in the laboratory. And when they were looking at hockey players, looking at a cutting manoeuvre, using this data, they were able to predict whether people would have injury or not. And sadly, the hockey players did have injury. ACL, there was a huge spate of ACL injuries in Australia. With all of this data that various people are collecting, we can pull it all together and develop personalised neuromuscular models. Now, what if we could do this for the brain? Because in the field, using techniques in biomechanics and artificial intelligence and computer vision, we can take someone from the field and use their personalised model and then predict a variety of different things. Already, if you look at here, we can track people in real time. This is a still taken from a video from the Athletics World Championships. We can calculate in real time what the velocity is and predict who's going to win here in terms of the race. This one here is with football. We can track in real time the movements of people to see how they're performing and look at tactics and techniques. If we can use this information to look at how they're tackling, how they're taking people to the ground, we can then inform education to reduce the risk of head impact. Now, people at the moment are really asking about, well, do repeated blows to the head result in long-term damage, and am I going to get dementia? This is the 2020 Lancet article, which shows that there are potentially a number of factors, 12 risk factors, that if we could reduce all of those 12 risk factors, we would reduce the effects of getting dementia by 40%. But look, head impacts, which we're all focused on here at the moment. Oh, back we go. This one. It's only 3%. There are so many other factors that we need to look at. Everyone wants to know about cause and effect. As a scientist, I would love to be able to say, if you have this number of brain impacts, you're going to end up with dementia in 17.3 years' time. Well, I can't do that because we don't have the data, and it's multifactorial, and individuals have a lot of variation. But we've got to start somewhere, and we need to be compiling these data so that we can predict. There's a lot of questions. Where do we start? Well, what we've done is linking with Sir Richard Fall and Helen in the group with the Brain Bank. If we can work backwards from there and go from a young child who wants to participate in sport, we're going to follow them over time, we're going to get their annual brain warrant of fitness, we're going to see what might matter and what actually results in CTE. Until we have those studies, we cannot categorically say this caused that. And that is the problem, and it's very frustrating. And, as a scientist, as I say, you'd love to be able to say that and give people the answer. What we do know, and this is the fact sheet which is available from the Traumatic Brain Injury Network website, is that we do get cognitive functioning difficulties with repeated TBI. We do have evidence of that. And it is likely that you have increased risk of brain disorders in terms of dementia, Alzheimer's, and possibly stroke. So we're trying to provide education so that people can understand and make informed decisions. We know that education can work. So in the 1993, when I started my postdoc, funded by ACC, I know you all hate ACC, but they've made some very good things, we developed SportSmart. It was a 10-point plan. Way back in the 2000s, we developed a concussion checklist that people had on the sideline. Well, history repeats itself because back in 2014, we had the national guidelines, the first ever national guidelines for concussion. Well, this year, the Sport Collaboration Group announced the first national guidelines for concussion. I was like, oh dear, you forgot about the history. But the important thing is we're all trying to educate about how you identify concussion, how you get good treatment. We know that education works. Dr. Ken Quarry, our senior scientist, for his PhD, he developed the Rugby Smart Tackle intervention program, and he showed that serious spine and brain injuries could be substantially reduced after Rugby Smart. So education and knowledge and awareness and behaviour change is vital. We need to up the ante a bit, we're in the 21st century, and so we do have things like your virtual coach. I talked about anterior cruciate ligaments and we know more about it. Well, we have the Blue Fairy. This was a collaboration between New Zealand Netball, ACC and AUT, and it's a game where children can learn how to jump and land safely, because we know with injury mechanics, if your knee goes inwards, you're more at risk of an anterior cruciate ligament. And so there's videos, and there's colouring in books, and there's virtual reality. You can use your phone and have the little fairy on your shoulder. It's educating people to engage, to learn about injury prevention and what you can do. And it's not just children that we need to educate, it's the GPs. How many times do I hear someone saying, I went to my GP and they didn't know how to screen me for brain injury? Well, Alice has led a team with the brain injury screening tool. It's available. We just need people to learn how to use it and to ensure that they're getting the appropriate care. And we need to pull it all together so that we've got increased education of people to know about brain injury, that we have quality research programs, that's where Neurological Foundation and others are so important, where we have activation by groups like Sports Smart and the rugby codes. We need clinical service providers. We need to know who to refer to, and we've got to always remember he tangata. It's about our people and our whānau, and they always have to come first. So I'm very proud to be part of the TBIN and the collaborative network, and I thank you all for your contributions, because it's vital if we're ever going to get the vision of, what's it going to be called? I don't know. But imagine if the AA, like Specsavers, every 2 years, when you remember, you get a free eye test, don't you? If we could have a brain warrant of fitness, a brain hub, and we could get a free brain check every 2 years, how fabulous would that be? That's our vision, TBIN. Thank you very much.